Ma'am, good morning. Deepika ma'am, good morning.
Hello, good morning, sir. Good morning, sir.
Yes, ma'am, you are properly audible, and I just want to check that whether your camera is working or not. Please try to put your camera on. Yes, ma'am, that's fine. That's fine. Okay, ma'am. Thank you. Thank you, ma'am. We have to just wait for 3 minutes, and after that we may start.
Sure, sir, sure.
Hello everyone, a very good morning to all of you. My name is Abhijit Devnath. On behalf of NIT Pharmacy Institute, I welcome you all in our today's webinar. Today we are organizing one webinar on pharmacoeconomics, upcoming challenges in post-COVID era. Dear participants, I would like to inform you that today a very eminent speaker, Ms. Deepika Pathak ma'am, she will be with us. She will be teaching us that how the post-COVID era is actually being challenged and what will be the role of we pharmacists in the field of pharmacoeconomics. Dear participants, in this COVID pandemic, we have seen a lots of challenges. It says that recession is on the way, and after that, we're going to face a severe climate change, and then there might be chances of biodiversity collapse. So challenges are here in front of us. So now how we can fight with those challenges, and what will be our role? So to teach you that, we have to train, we have to encourage our youth with awareness, we have to give proper skills, and we have to build up the confidence among the students, and we have to also encourage and empower our youth with knowledge. That's why Today, we're organizing this webinar, and Government of India is relentlessly trying their best to encourage youths in the field of research, innovation, and entrepreneurship. Government of India has formed one that's council under Ministry of Education Innovation Cell, and under Ministry of Education's Innovation Cell, they're actually directed that all the top institutions should form institutions innovation council. And I'm very happy to inform you all that in our NIT Pharmacy Institute, we also having our one institutions innovation council. And under the banner of institution innovation council, today we are organizing this R&D training, R&D and innovation training on pharmacoeconomics. Start our this event to bless us. I like to request our honorable director, sir. Sir, with your guidance, with your blessings, we may move forward and start our this event. Over to you, sir. Good morning, sir.
Good morning. Good morning. Thank you, Vijit, for your very nice, lucid introduction. As we know that
Put volume down. Yeah.
as we know that the
Yes, yes.
country is undergoing certain changes, Atmanirbhar Bharat has become one of the key slogans of the day, where people are trying to prepare their own requirements within the country. Swachh Bharat Abhiyan, Health for All, these are some of the dream projects of our Honorable Prime Minister, Mr. Narendra Modi ji. And in continuation with this, Noida Institute of Engineering and Technology, Greater Noida, Pharmacy Institute is hosting this R&D innovation training webinar on the topic pharmacoeconomics, upcoming challenges in the post-COVID era. Now, as all of us know, that this COVID period has made a gross change in the economic scenario of the country. Many people have lost their jobs. The industries have been shuttered, except the pharmaceutical industry, because as long as people will survive, medicines will be required. But at the same time, we should realize that when a people is hospitalized, a lot of expenditure he or she has to incur. And it is our suggestion at this point of economic crisis that unnecessary drainage of money in the form of the healthcare needs should be restricted. Therefore, it is a need of the hour to select a topic like this, where our speaker of the day, Deepika Pathak, will be highlighting what is the role of pharmacoeconomics in the period to come, and how the citizens of the nation will be in a position to save money and get a quality healthcare treatment in various hospitals and industries. Without taking much of your time, many students, many faculty members, many delegates, they are waiting. I would like to hand over the stage to Deepika Pathak, who is a favorite student of us, of our institute, and now a faculty who is doing key research on the area of pharmacoeconomics. With this, I would like to announce this webinar to open, and I expect that this webinar will bring a lot of consciousness in the mind of the people. Thank you very much.
Thank you so much, sir. Sir, with your permission, I just want to share the brief bio of our today's speaker. So, participants, let me share the brief bio of our today's speaker. Deepika Pathak ma'am has done her diploma in pharmacy from Mirabai Institute of Technology in Delhi. Her B.Pharm was from NIT Pharmacy Institute, Greater Noida. She did her M.Pharm in pharmacy practice from Naipur, Mohali. And currently, she is working as a assistant professor and she has more than 5 years of teaching experience in this field. She is very good in pharmacy practice. We also have seen several lectures given by her in Acatu Digital Education and in MOOCs platform. So with this, I'd like to welcome our today's speaker, Deepika Pathak ma'am. Ma'am, please teach us, encourage us, and tell us how the challenges are actually upcoming days we are going to face in pharmacoeconomics, and suggest, encourage our youths so that they can fight in these challenges very nicely. Over to you, ma'am. Good morning, ma'am.
Thank you so much, sir. Am I audible?
Yes, ma'am. You are audible.
First of all, thank you so much, sir, for this beautiful biography. A very good morning to one and all who are present here. Uh, I myself, Deepika Pathak, currently working as assistant professor in Noida Institute of Engineering and Technology. Before proceeding as a speaker, I would like to give my deep gratitude to Director Sir, Dean Ma'am, and whole management of NIT Pharmacy Institute, Institute Innovation Council for organizing this webinar, Pharmacoeconomics, the upcoming challenges in the post-COVID era, and this is actually required. I will try my best to give here so that everyone who are present here will get to know about what are the basics of pharmacoeconomics and how it's going on, how it is affecting in the COVID era. So thank you so much, everyone. Let's start. Sir, may I proceed?
Yeah. Please, ma'am.
Is it visible on screen?
I think it will take some time.
Okay.
Yes, ma'am. It is completely visible. Please proceed, ma'am.
So yeah, there are so many challenges which are associated with the economics. I will talk about the how the drugs are, how the medicines are, what are the treatment options we have seen in the COVID time. But before going very straight on the challenges, I would like to tell you about some concepts regarding this pharmacoeconomics. Sir, I can't change the slide.
Ma'am, I think you have to click on arrow.
Working, I'm trying
Ma'am,
it.
your voice is breaking. Yes.
So yes, the pharmacoeconomics, if I'll talk about this particular term, we are talking the money value of the treatment options, the allocation of the resources. Here we are mainly focusing on the two things. The cost we are spending on the treatment, the strategy, the treatment of the particular patient, or the treatment which is given in the hospital, the cost we are spending on all of these things, and we are also ensuring the consequences associated with it. Yes, so here we are also checking the outcome. So there are two terms which you can see is the pharmacoeconomic and the outcomes. This is one of the fast growing area, yes, and it is actually required. We are noting here the eco model. Okay, we are seeing the clinical aspect, we are checking the economic aspect, we are checking the humanistic aspects of the pharmaceutical products. Later on, I will tell you what do you mean by the clinical, economic, humanistic aspects of the pharmaceutical product or the services which are given by the pharmaceutical industry or the hospital or the clinics. Uh, so basically, you can see this picture on your screen. In this, we are giving the alternate option. Okay, so there is a one line you can pick from here. Is we came up with the pill that cures everything. Okay, but yes, there is a one warning. It's gonna be expensive. Means there's many options. Patient, there could be one perspective from patient side, there could be one perspective from societal side, there could be one perspective from provider side, there could be one perspective from a societal side. There are many perspectives which can be watched from here. And here we are actually providing a model through which we are taking the decisions, like which treatment need to opt. Okay, which is economically benefited, not only in terms of the money value, but also the term of effectiveness, the benefit, the utility of the patient preferences, the quality of life. Okay, so the pharmacoeconomics here, we are measuring the cost. Okay, means how much the treatment cost for, how much the money is spending, but also the consequences. Okay, if a patient is taking a particular pill for the treatment of hypertension, is it actually going to work? Is it actually decreasing the blood pressure? Or it is, if the patient is taking a particular drug for the diabetes mellitus, is actually treating the diabetes? So these are the consequences. We can also check the clinical consequences, the money is actually worth or not. Okay, so there are clinical consequences, then economic. Of course, we need to note out, yes, the high cost every time not ensures the perfection of the treatment, yes. So we need to note out the economic consequences as well. Okay, means there are sometimes we can minimize the cost and will get the better treatment options, yes. So that is we are doing here by applying many of the models, and one of the model we'll discuss in the slides later. There are humanistic consequences also need to note out, like if they are spending some money, the quality of life of the patient is improved or not, yes. So this is a little about the pharmacoeconomics, means what we are doing here is the cost, we are spending some money, and we are checking the consequences, which could be clinical, economic, and the humanistic, yes. Now you will see it is this concept can be applied to many of the areas, yes. Now, what are these areas? We can prepare a formulary. So I think we are from the pharma, so we all know in the hospitals there is one thing required, that is a hospital formulary to treat the patient. Okay, so they are the list of the medication. It is prescribed to the patient. The medication which are listed in the hospital formulary. So hospital formulary are prepared from one of the concept we are using here is the pharmacoeconomics. Okay, we are trying to optimize the cost. We are trying to give better therapy to the patient in optimized cost. Yes. So this is we can do in the hospital formulary. This is applied. And if we are planning any new therapy, okay, so there are some clinical trials which are going on. Every year we're seeing number of lead molecules are coming, and we are seeing a lot of researches are going on. So how the drug comes to the market, there is a one concept of pharmacoeconomics we are applying. Okay, we are noting it. Yes, there are so many options which are in the market, and these are the options which the patients are using, like the drug A, drug B, which is already in the market, established for a particular treatment. Now there are some clinical trials which are going on just to reduce the side effects, to target delivery, okay, to reduce the cost of the therapy. And if it is, yes, if we are successful for it, pharmacoeconomically we find it a good option, of course then we'll try it in the market, we'll launch it in the market. So this is also one of the concepts we are applying for the new therapy. Similarly, yes, this is also required for decision making. Clinicians are making decision from the pharmacoeconomics. The use of this concept, they are using it. Not only the clinicians, but this concept is also used by the insurance companies who are reimbursing the money to the patient, who are paying, means a third party who are paying the treatment cost. They are also using this concept of which one is the feasible treatment option, is the surgery or the just taking pill for the ears is required. So this is all they are calculating, and they will identify according to, they will calculate what money actually need to give to patient or to the hospital, yes, depending on what the claim is. So yes, these are some of the applications. Apart from it, we are also seeing here about the limited resources. So we cannot spend money for a same treatment for many of the drugs, yes. What we can do is to separate these things, and will try to take out one option which is better, one or two option, so that we can spend less, but of course we can improve the treatment, we can reduce the duration of the treatment, or we can increase the survival rate, we can reduce the death rate, we can reduce the hospitalization, and it should be effective for all of the patients, yes. So this is how we are using this concept for allocating the resources, okay. So these are some of the applications where the pharmacoeconomics can be used. You all should know this is not only a simple term. This contains a lot of things and used in all of the areas where the treatment is applied. Um, we are using it for the decision making, to allocate the resources, to identify a new drug which need to be launched in the market on the basis of money value. Is it actually worth, or for the decision formulary making, to make the standard treatment guidelines it is required, yes. If they are making the national treatment guidelines for a particular drug, for a particular disease, so it is required at that time. Then pricing is done by the pharmaceutical industry only on the basis of pharmacoeconomics, yes. If in the pharmaceutical industry there are 2-3 drugs, okay, like drug A, drug B, drug C in the for a particular treatment. We are taking an example of a diabetes. So how the pharmaceutical industries are quoting the price, it is all depends on how much the cost actually is required for producing the drug. But apart from it, how the beneficial drug is, okay, how much the survival rate it can increase, how much the benefited patient will be with this drug. So this is how they are designing the pricing for the patients or in the market when they are launching it, okay. Reimbursement, I already explained this thing to you, like in the insurance companies, what happened, the reimbursement of the money is not just what the hospitals are claiming or the treatment are claiming. This all depends on the pharmacoeconomic. Actually the treatment is required for the patient, or the surgery is required, or the pills which the patient is taking is required. Depending on the insurance companies will decide, yes, what amount actually is given to the hospital or the claiming agency. Now, with this concept, in this concept, we are noting here the two things. One is the cost and the outcome. The outcome should be best. Okay, they should be best healthcare outcomes in terms of the money we are spending here. Okay. So there are 2-3 things need to note out. One thing is we are giving a input cost. Okay. Input cost is of course the money value, and we need to analyze the outcome. Okay. And the outcome is a eco model. Okay. In between of it, there is a perspective, means from which perspective we want to note it, from which perspective we want to apply the model, from which perspective we want to take the decision. Okay. So Yes. See, I told you in the previous diagram there was a two thing need to note is the cost and the consequences. But there's a one confusion regarding the cost and price. When we are talking for the money value, there are two things: cost and price. We are talking. Now, what could be the difference between these two things, cost and price? See, cost means the all of the resources which are actually required to produce a particular service or a drug therapy. Okay, so that money value is calculated as cost. Now we'll talk about the price. Means it is a willingness of the depends on the willingness of patient or a consumer or customer want to pay for the particular service. So usually the price, if I'll say the price is higher than the cost if we are talking for the profitable business. Yes. So here we are talking for the cost, means all of the resources which are required to produce a drug therapy or a particular treatment, okay, or particular treatment strategy. See, when you are seeing anything regarding the pharmacoeconomics, the values which are written, the money values which are written, they all are depend on the type of cost. Okay. Now, what are the type of cost here? There could be many of the costs. One is the direct medical cost, direct non-medical cost. These two costs are the direct cost. Okay. There are some other cost as well. Indirect cost. Then there is an intangible cost is also calculated. Opportunity cost is also there. So first we'll see the direct cost, which includes the two of the thing, medical cost and non-medical cost. So what is the direct medical cost? Direct medical cost, with the way this name we're clear, like what are the services we are taking, the medical services we are taking. So what could be the medical services? See, medical services could be the consultation charges, okay, then the cost of the drugs, the syringes, the needle, okay, and if surgery, if the formulation we are taking, the services the hospital is providing, they all are under the medical cost. Okay. Here we have also differentiated the medical cost into two things: the fixed and the variable. It could be fixed, it could be variable. If it is fixed, means they will not change on the number of patients. Okay, so we know the capital, the hospital building, the equipments which are used in the hospital, they are not changed actually. Okay, they are not the values, the money value will not change on the number of patients. Of course, that will be same. Okay, but the variable cost, if I'll talk about, so it depends on the number of patients, that the number of the cost of the drug, or the syringes, the needles, or the other services or other equipments which are used for the treatment may vary. Okay, so this is how we have segregated here. There are sometimes a non-medical cost. They are the direct cost. This requires like if there is a transportation, the ambulance charge. Okay, the amount or the money which is required for the patient, and that is a form of a service the hospital is providing to receive a patient. If the patient is coming to the hospital, that particular type of charges, or if we are moving one patient from one hospital to the another hospital, so that type of facility, the facility which is required at that time, the cost is associated with it is under the non-medical direct cost. So apart from it, the direct medical cost and direct non-medical cost, we are also taking a indirect cost under the pharmacoeconomics. When we are seeing the values like this particular treatment is with this cost, the cost effectiveness ratio is this. So these all of the costs are associated in it. Okay, so you need to know about these of the cost. Now indirect cost means the income which is lost due to absenteeism. And why there is a absenteeism means the patient is suffering from we can say fever, or if a patient is suffering from a lot of pain. Okay, so of course at that time there are the chances of absenteeism, and not only the absenteeism, it is related to loss of the wage. if the person is doing a job. So this type of costs are also included here. Okay, so income lost from the absenteeism. Now there's a productivity lost at the job. So this type of cost is under the your pharmacoeconomic study. Apart from it, there is an intangible cost as well. Intangible cost is difficult to quantify just because we can feel it only. So there are sometimes we are making the questionnaire for it. There are some scores, how the person is feeling, how the patient is feeling about the pain. Okay, if the patient is feeling from the arthritis, there is a pain the patient is feeling. At that time, there are some questionnaires. So we can make out the appropriate result from that questionnaire, like what could be the cost associated with this particular disease or this particular condition. The cost of pain, the worriness is there, or if the patient is suffering, or of course it is psychologically or anyhow it is impacting the family as well. Okay. Then there is a opportunity cost. See, these three costs which I already told you, direct cost, indirect cost, intangible cost, they are related. Opportunity cost, if I'll talk, opportunity cost is a very different type of cost. See, for any treatment with very blessed researchers we have many options. Okay. Now, if I'll say the opportunity cost, you can find it as application of the pharmacoeconomics. And this is how, when I will say about this opportunity cost, you will get to know, yes, how it is applied. So if we have 2-3 options and if we select the wrong one, okay, then what could be the extra cost need to pay on it? That is under the opportunity cost. And here the concept of this pharmacoeconomics comes in the picture. Okay. So whatever the options we have, if we'll take any wrong decision about it, what are the extra consequences, what are the extra costs associated with it, will lead one value, that is the opportunity cost. It is under it. So I told you in a very beginning, the pharmacoeconomics, there are 2-3 things required: the cost and it lead to the consequences. We are noting two of cost and consequences. In between of it, we are noting one this perspective part. Okay, from which perspective we want to see it. Okay, like patient perspective, provider perspective, payers perspective, societal perspective, and of course the values of the values we'll see from these of 4 perspectives will differ. Okay, so these perspective will talk about the patient perspective. Means we are seeing the cost, the amount we are spending on the treatment, and the consequences. Consequences could be clinical, humanistic, okay, economic consequence. Here we are taking the direct cost, medical cost, non-medical cost, transportation cost, yes, consultation cost. Indirect cost, we are taking the loss of absenteeism and intangible cost like pain, weariness, which is not quantifiable, but yes, we need to measure it, okay, through some of the questionnaires. So this is all which we can note from the patient point of view. Okay, I will see the provider perspective. So provider perspective means the physician, what the physician can see, okay, what the clinicians can see. So physician can see the direct cost, okay, either it is a direct medical cost or direct non-medical cost. Okay, so what are the consultation charges, how many times a patient is coming, what are the drugs the patient is getting, what is the prescription number. This is all the provider can see, and this is this expense is noted from the provider perspective. So the value you can see, the difference you can see from here, how the values will be different from these perspectives, the provider perspective or the patient perspective. Now, payers perspective. Payers perspective is we are saying here the insurance companies, okay, the private insurance companies, the third-party payers, there are sometimes government insurance, social security schemes are there. So what these schemes or the insurance companies can note? They can note the direct cost, medical or the non-medical cost, indirect cost, the productivity lost or the loss of income due to absenteeism, okay. Now the best one which I can say from these three which we have already covered is uh, uh, the fourth one here. You can see societal perspective, okay. So the societal perspective is from the society point of view, and here we are taking numbers of people, okay. So this is little bit objective data, not depend on only a particular patient. We are not individualizing things, okay. Here we are talking means how many numbers, in how many numbers we have improved the survival rate in the patients. Like there is a one medication, drug A, which can improve 5% increase in the survival rate in the population. Yes. So this is we are checking here, okay. And on the basis of that, the value for the drug is measured. The value for the particular therapy is measured. So we are checking the direct and the indirect cost, but from the society. Okay, so this is the objective data, not subjective. Okay, so this is a good one. Where we are launching a scheme, the government schemes, the national health programs, they all are depend on the societal perspective to reduce the amount which we are paying on the therapy. But yes, we are not compromising with the effectiveness. We are not compromising with the treatment. Okay. Now here we can see the eco model, the outcome. So I have already discussed about the cost, which we'll see in the pharmacoeconomic study. So there are different costs. Then the perspective I told you, which perspective we want to note. And according to that, we'll put the value, we will put the cost, which type of cost we want to include, like direct, indirect, intangible, or the opportunity. So eco model means what type of consequences you want to note. So there are the three consequences here, and we need to note all of the consequences, not only the single one. Okay, this is, we are saying here the pharmacoeconomics. Okay, this is not only the economics, this is the pharmacoeconomics. So economic outcomes, okay, means what is the actual money is required. Then clinical outcomes, if the patient is taking a particular medication for the hypertension, a patient is suffering from a BP of 140 mmHg, and we'll see 140 160 mmHg, and patient had taken a particular pill, drug A. I'm taking an example of drug A, and at the time the patient will feel the relief in the blood pressure level, okay. And there's some other options as well, like drug B, drug C. The patient in the second scenario, we'll see the patient had taken drug B for the same situation, for the 140 mm or 160 mmHg blood pressure, and the patient had taken the pill, drug B. And at the time, we'll see there is a time differences to relieve the symptom. Okay, in the scenario one, the patient will relieve just only in the half an hour. Okay, in the second scenario, the patient take actually the drug that patient had taken is taking a lot of time. So this is all under the clinical outcomes. Okay, how much the duration we can reduce for the therapy, how early we can improve the symptoms. Okay, how early the patient will be discharged, what are the number of lives cured. Okay, so this is all under the clinical outcomes we are measuring in the pharmacoeconomy. Then there is also one thing, humanistic outcomes. If I say the humanistic outcomes, it means patient preferences. Okay, see there are two options. In the humanistic outcome, I'm just giving one example. Just decide as a treatment of diabetes, we have one option with a drug A can give the life for 5 years. Okay, and there is a second scenario. We have a drug B, which is giving the extra life years of 10 years. Okay, in the first scenario where we are giving the extra life years of 5 years with a drug A is actually with a less quality. Okay, and in the second scenario where we are giving the extra life years of 10 years, okay, is of more less quality. Okay, and there is a third scenario we can also take. Drug C, which is launched in the market with a good efficacy, with a good effectiveness, and we are giving the life of 3 years but a very good quality. Okay, so now we need to see it from there are many perspectives, so to see it, like what are the other things also related with it. But yes, we need to see if we want to improve the life with a less quality, or if we want to live the life with a very good quality, but yes, less survival rate. So these are some of the options. Okay, and we need to think of from a different perspective which is actually required. So we are taking here also the patient's perspective. Sometimes we are giving the option for a particular treatment, like the surgery is also there, the treatment with the tablets or the pills is also there. Now patient has to decide, the patient want to go for the surgery, or patient want to go for the only the tablets or the pills, or the patient want to go for some other options if it is there. Okay, so this is all under the pharmacoeconomics, the decisions which are taken, and they all are based on the these consequences or the cost we are spending on the treatment. Okay, so this is a very big science. Now now see the decision tree analysis. I told you the cost and the consequences, and in between of it we are seeing the perspective, which perspective we want to note it. In the decision tree, we can see how we'll reach to the conclusion. Okay, so if there is a population and the population is suffering from one of the disease, here we are saying here H1N1, there is a one segregate population with no H1N1. Okay, now the people who are suffering from the H1N1, they require treatment. What type of treatment they require? They can require the ambulatory care. Okay, they just go to the hospital, take the treatment, and then will go. They will come back to the home. So this is one of the type of the treatment, the ambulatory care they can get. Then no medical care. Some patients don't require the treatment. Okay, so this type of also one of the option here. Now the patients who are getting the ambulatory care, there could be two conditions. Okay, either they will go for the further for the hospitalization, or they will be outpatient. Okay, so if they will be hospitalized, and we'll note the probability of all of these things. Yes, how many are H1N1, how many are with a no medical care, how many are with a ambulatory care. So we need to note out the probability of all of this. Okay, and the cost per patient it is required, and this is how we are deciding the treatment pharmacoeconomically is beneficial. Right, so in the ambulatory, what I was telling is the two option, the hospitalization and the outpatient. Now in the hospitalization, there is also two conditions. There are some patients which are further for the ICU. There are some patients which are inpatient. Okay, yet they are inpatient. Then for the ICU, we'll see there could be another condition. There are some patients which are for the death, which are in inpatient, which are as an inpatient. Okay, then we'll see the further consequences. Similarly, for the inpatient, there is a chances of the day, their chances they will be healthy. Okay. So this is the services given in the hospital. The ambulatory care is given in the hospital. The hospitalization, the treatment they are giving in the hospital. The ICU, how many cases are cured? Okay, how many deaths are reported with a care? How many inpatients are there which are healthy? How many are outpatients who just cure by taking the ambulatory care? So this is all need to note out, and if there are some options we are getting, yes, this is a particular magical drug which is going to show, yes, it is of high value in cost. Initially we will see, yes, this is of high cost value, but if it is improving the patient's health, yes, if it is decreasing the death rate, if it is improving the survival rate, then of course that will be at the time that will be pharmacoeconomically beneficial. Okay, so this is all we need to note out, not only on the basis of the value, the cost we can see, we are not deciding the therapy. Okay, there are many things need to note out. So types of study, see there are 4 types of study, and I will show you some papers here also. The studies which can be done for the pharmacoeconomics, like the cost minimization analysis, cost effectiveness analysis, cost benefit analysis, and cost utility analysis. Yes. Cost minimization analysis. This is a very simple study. Okay. What we'll do here is we need to see the therapeutic equivalent product. Okay. What could be the therapeutic equivalent product? There could be the branded products or the generic products. They have a therapeutic equivalency. Now, on the basis of therapeutic equivalency, and that should be same, this is one of the condition of cost minimization analysis. Now, what we need to see here is only the cost. Okay, only the acquisition cost. So here you can see there is a drug A, drug B. Now acquisition cost is 250 for drug A, 350 for drug B, and the outcome which you are noting here is therapeutic equivalent. They should be same. So you can measure the cost minimization analysis for a paracetamol injection with a paracetamol tablet. Okay. For a particular treatment, or for reducing the fever in the arthritis, or for reducing the fever in some of the other diseases. Okay. So here we are checking for the antibiotic effectiveness. So what we'll get to know from here is 90% effectiveness is there with the antibiotic, and drug A is showing a higher cost, in the cost minimization ratio. That would be a better option. Okay. Now this is one of the study, a meta-analysis study. Cost minimization is done for the bivalirudin. This is a direct thrombin inhibitor. It is checked with the heparin. Okay. This is used for the patients who are suffering from stroke, coronary heart disease, who are on the treatment of this percutaneous coronary intervention. So those of the patients require these direct thrombin inhibitor, or these patients are requiring some anticoagulants. So there is a one option that heparin can be given to patient to decrease the the chances of the stroke, or to reduce the thrombotic event. Now here we can see in this study, the meta-analysis, it is showing that the safety and efficacy reported in the RCT, randomized controlled trials. The use of the direct thrombin inhibitor, the bivalirudin, will compare it with the heparin in high-risk patients. So heparin has shown the better economic benefits over the bivalirudin in a specific population. Okay. So how we have compared this? This is all we have compared on the basis of the effectiveness we are getting from the patient. Okay, like if there are two options, the heparin and bivalirudin, and we have given it to the patient, we have seen the adverse effects are reduced. There are the less chances of the bleeding. There are the less chances of the stroke. We have seen the this is a life-saving drug. Okay, so this is all coming from the data on the patients, and this is how we have seen the heparin it is a better economic uh, benefit. It has shown it over the another drug. Okay. The second type of study is the effectiveness analysis. The effective analysis is a second type of study. Here we are seeing the consequences on natural units. Okay. So in the cost minimization, I told you the cost is also, of course, it is the money value, but the consequences were of therapeutic equivalent. Okay. Here the cost effectiveness analysis, we are the cost is of course the money value, but the consequences is in the natural units. So we'll see how many cases are cured. Okay. If the patient is hospitalized, how many lives are saved. Okay. Then how many hospitalization are prevented, with how many days the patient get the treatment and discharge early. Okay, so effectiveness, in the effectiveness we are seeing the natural units, the consequences are as what I told you, and then we'll make the decision. Okay, like which treatment is effective. So here what we are calculating is CER. So we'll see the pharmacoeconomic study for a particular therapy or a drug. You will get to know about the CER, that is a cost effectiveness ratio. Okay. So see one of the example here, the cost is written like the acquisition, administration, monitoring, adverse effects. Okay, and all of this we have subtotal it. So for the drug A it is 500, for drug B it is 400. What are the outputs? So as I told you, for the effectiveness we are checking the natural units. Okay, and what are the natural units here? How many extra life of years we have added. So for the drug, if the patient will take a drug A, it will increase the 2.22 life years. Okay, that extra life will be added. Okay, whereas for the drug B, 1.6 life years will be added. So with this value we are very clear, yes, where is the benefit. Of course, for with the drug A we are on a benefit line. Okay, so 2.22 years are added here. So we'll calculate the cost effectiveness ratio. 500 rupees cost per 2.2 life years, accountable to 225 rupees per extra life years. Okay. Similarly for the 1.6 we can see, which is quite less. So lower the cost effectiveness ratio will decide, yes, this drug is beneficial. Now coming to one of the pharmacoeconomic value analysis of one drug, sitagliptin, coming with the brand name of Genovia, dipeptidyl peptidase inhibitor, one of the drug given to treat the diabetes mellitus. So there is one study done on the 100 patients with diabetes mellitus, and they are divided into 4 groups. Okay, the patient in a group A received the pioglitazone. The patient with group B got sitagliptin, and the group C with a metformin drug, and group D with a glimepiride. Okay, so the conclusions were taken on the basis of fasting plasma glucose level, then 2 hours plasma glucose level, then HbA1c levels. All of these levels were checked. Okay, and it is resulted that it will compare with the sitagliptin with other 3 options: metformin, glimepiride, okay, and pioglitazone. The incidence of the adverse effects in the sitagliptin is less. Okay, so we can say, if we'll see the natural units, we can say yes, it is more effective, the drug is more effective. So this is how we will take the ratio, cost effectiveness ratio, and will decide, yes, this particular drug should go for the treatment. Okay, this particular drug should follow in the hospital for the treatment of particular disease. Now there's also another study, the benefit analysis. The cost benefit analysis is based on the ratio of cost to benefit to cost. Okay, here we are giving the monetary values to cost as well as benefits. Okay, so cost, of course, it is the money value, but benefits are also measured in monetary values. Okay, so if we are saying the number of days the patient with taking a particular medication is going for the job, so we'll calculate that value. Okay, how much the patient is benefited from it, so that value is added as a consequences. Okay, so this is little bit different from other two studies. From in the other two studies, we are not taking the consequences in the monetary value, but yes, in this study we are taking the money value in the monetary values. Okay, consequences in money form. So here we can see one example here, like a cost and benefit to cost ratio. For the drug A, drug B, the subtotal for the drug A, we can see 500. Okay, like acquisition cost, the administration of the drug. If it is injection, of course, it requires the nursing services, the monitoring of the drug. Okay, the adverse effects reported, how many days it required to monitor. So this is all under the cost for the drug A and drug B. So here we can see, yes, drug A is showing the higher value. Okay, but if we'll see the benefits, so days at work, so it is accountable for 1,000 rupees. Okay, for drug B, the same value, but extra months of life year is added, will give the value. Okay, so that is 2,000, and for the drug B it is 3,000. So accountable for benefits, we will see the 3,000 for drug A and 4,000 for drug B. Okay, and we'll calculate, if we'll calculate the benefit to cost ratio, we can see it is on the for the drug B it is higher. Okay, so this is how we are deciding the therapy, by accounting the benefits in terms of the monitoring, in terms of the monetary value, and if we'll say for the effectiveness, we are seeing the natural units. Okay, so this is how these models are applied here. This is one of the study done for the cochlear transplant, and this is the societal perspective. This is that's why I told you about all of the perspective before, like what could be the perspective, from which of the perspectives we need to note out. Okay, and you need to know what are the models applied for it. You need to know the what are the cost applied for it, the direct, indirect, intangible, opportunity, all of this. Okay, so here we can see the conclusion. What conclusion is noted? Cochlear transplant is basically used for the people who cannot hear so well. Generally used for the old age geriatric population. Okay. So here we have seen the estimate from the modeling, the decision tree analysis has shown the increased healthcare cost, okay, due to the cochlear implants were more. Okay, then they compensated by the value of the health benefits and by the savings in the educational and productivity costs. See what happens here. If actually there is a segregation of the population for the for this transplant if we are doing. So there are some prelingually deaf children which are who are implanted at the age of 1. Then there are some adults with a progressive profound hearing loss who are implanted at the age of 40, or there are some seniors citizens. There are some the geriatric population which require the implants. They have the progressive profound hearing loss at the age of more than 60 years. So this segregation, if we'll see the this demography, and will calculate the educational and productivity cost. So according to this, yes, CI, the cochlear implants, they are showing the increased healthcare cost. But if we'll see the productivity cost, if we'll see the educational cost, ultimately we'll get to know, yes, the cochlear implants generate advantage for both patients and the society, and this is they are reducing some of the educational cost or the productivity cost. So this is how we are planning the new therapy or a new treatment we are applying to society. Okay, so this is all calculated here. Now the utility analysis is the last one in the analysis for checking the cost or to identify the consequences. So there is a one type of consequences is the patient preference. Okay, the quality of life the patient has improved. So if we can take an example here like chemotherapy. Chemotherapy increases the survival but decreases the patient well-being, and this I already told you. Okay, what we want to achieve from the therapy, we want to increase the number of life years or we want to optimize the life years with a very good quality. This is all depends on us. Okay, that would be the patient's perspective. From the patient side, the patient can give the decision for it. Yes, the patient wants this particular option, and this requires the pharmacoeconomic analysis. So here we can also see one thing, the differentiation between two therapies, drug A and drug B. So utilities is as a consequences, extra years of life and the quality of life. We are more focusing on the quality of life. We are adding the extra life years, but that should be of good quality. Okay, a person is suffering from any disease. Let it take an example of a cancer, and the patient is suffering from cancer, suffering from a severe pain. Okay, we are giving some medication to patients. The patient is improving the number of life years. Okay, 5 years, 6 years life, we have added extra life years, but the patient has not a good quality of life. Okay, whereas in the second scenario we are saying yes, the patient is getting a treatment and suffering from a cancer, we are giving a one drug, it is improving, it is giving the extra life of years of only 3 years, but the quality of life is very nice. Okay, so this is, we have to see where to go, which option to select, and this is all depend on not only on the cost of the treatment but also on the effectiveness, the benefit and the utility. This all thing will need to note while deciding the treatment and from which perspective we want to note it. Okay, so this is, here we can see the quality of life years added, and we can calculate the cost to utility ratio. Okay. This is also one of the study done on the glaucoma medication adherence. So there is a one problem reported under the study is the medication adherence associated with the patients who are suffering from a glaucoma. They lead to the blindness in some of the ears if they will not follow the medication. Okay, so we have checked the cost utility analysis and the results are showing uh, beginning at the initial glaucoma diagnosis at the age of 40, the patients who are proceeded with the single eye blindness in early of 19 years, okay, who are following the medication, and the patients who are non-adherent, they are taking nearly 23 years. Okay, so to follow to proceed for the complications. So this is we need to note out here, like for the consequences associated with the disease. If they are severe, they are worsened with the non-adherence of the medication, or of course the adherence of the medication will improve the duration of the treatment, will improve the blindness which the patient is getting at the early stages. That will be improved here. The patient's, the quality of life will be improved here. So on the basis of this, we are deciding the treatment of the how the treatment of the patient should be. Okay, so pharmacoeconomics will saying in the COVID era. So in the COVID era, there are many challenges we are reported with. Okay, like the shortage of the drug supply, the restriction of import and export. Then there are the changes of the pattern in the consultation. Okay, there is a very big shift we have seen from the face-to-face consultation resulted to the interviews on the the consultation on the WhatsApp. Okay, so we have seen a lot of things, but in this study which I want to tell you here about is the non-pharmaceutical public health interventions. This has also changed pharmacoeconomics a little bit. Okay, now what are the result here is they have stated the adoption of non-pharmaceutical public health intervention in the COVID era. And what could be the non-pharmaceutical public health intervention means we are not talking for the medication or the treatment. We are just saying here for the precautions we are taking, like mask, wearing mask, or enforcement of the lockdown, and we can also go for the personal hygiene care. Okay, and nutritional diet, this is all under this, and this is, of course, this is impacting the pharmacoeconomics, this is impacting the this area. Okay, so we have noted here the result of this is one of the meta-analysis that is collected from many of the studies here. So results of the meta-analysis showed here adoption of the non-pharmaceutical public health interventions has resulted nearly 4.68% decrease in daily case growth rate. Okay, and this can be applied in pharmacoeconomics. If we know, yes, there are some non-pharmacological measures which are helping it. Of course, this is going to reduce the burden of the disease. This is going to reduce the burden of the hospitalization. Okay, and in the COVID area, we are seeing there is a lot of burden on the hospitals. Okay, the number of cases are rising very rapid. Okay, so we are seeing here the decrease in daily growth rates, decrease in the COVID-19 reproduction number, the ICU admission we have reduced. But yes, they are giving one of the condition that the enforcement of lockdown should be at the early stages. So if it is there, of course, we have reduced the number of cases in the hospitals, or we have reduced the burden of the disease which we are going through even now. Okay, so I will talk about the short-term and the long-term impacts of the COVID-19 on the pharmaceutical sector. So there are many more. Yes, many more. Now, there could be demand changes. Yes, we have seen it in the very initial, and of course, right now we are seeing the change in the strains are coming. Okay, the COVID-19 with the different strains we are seeing, it's coming up. So the demand of the drug, it is changed, and the, of course, import and export is impacted. There are some countries which are dependent at the time for with other countries, but now the pattern can be the pattern is changed with the self supplying, the self production of the medication. So this is the change in the pattern we can see in 2-3 years. Okay. The regulation revisions are required with this pandemic, which we have seen rising very rapidly and did a devastated changes. Actually requires one thing for all of us to think it very seriously about the regulations for the treatment strategy, what could be the health infrastructure should be for the country. Okay, how much the money we require to spend on it, which type of areas we need to target. Okay, like the well, talking about the oxygen cylinders, these all of the things are under it. Okay, so there is a requirement of the regulation revisions which are going on. Okay, and we are focusing now on it. And there is a research and development process changes are there. We have seen the shift towards the telecommunication and telemedicine. It is followed right now, but yes, a majority are following the face-to-face consultation. Even the doctors, the clinicians who are seeing the patients, they want face-to-face. But yes, there is a little bit shift after the COVID. We have seen through the telecommunication, the medications, the information services, this IT, the information communication technology, it is enhanced. Okay, the number of cases which are coming every day, we can see it on the government sites which are available. The medications which are coming, the awareness, these all of the things are going on in the IT platform, the information technology. So,
Excuse me, ma'am. Excuse me, ma'am.
yes, sir.
Ma'am, a few participants are asking that how many slides are remaining. How much time it will take to conclude your...
Sir, just 2-3 slides, sir.
Okay, okay, great, great, great. I hope
Okay.
participants you got your answer. Okay, thank you, ma'am. Please carry on.
Okay, so next to it is we have seen the industry growth slow down. We have seen the approval delays in the clinical trials. We have seen the self-sufficiency in the pharmaceutical production supply chain. Okay. There is a trend change in the consumption of the health market product. Yes, of course. In the very initial, we are seeing the medications are given only for the COVID area. So the patients who are suffering from the diabetes or some of the chronic diseases, they are not getting the medications. Okay. So we have seen the changes in these type of segregated countries like Middle East, European Union countries, or the United States. The short-term impacts like medication shortage due to the induced demand. Okay, so induced demand, of course, they are the COVID-related products. Okay, like OTC, personal hygiene care, they are on a high rise. Okay, ICU medication are on a high rise, but with this, we can also see the changes in the supply shortage. With the medications, with the chronic diseases, they are at a high risk for the shortage and supply chain. And this is also improving right now to change this thing to provide the medication for the chronic diseases, the patients who are suffering from it. Then there's also one change we have seen for the R&D, research and development shifts. Clinical trials are more prone for these areas, the COVID. And due to this, yes, the trials are going on the Middle East, or many of the countries who are not focusing on it, they are actually focusing right now on it, the R&D, the research and development clinical trials. And due to just because of this, there is a postpone of some of the meetings or some of the projects which are on the front. This also caused the approval delays, okay, for other disease areas. And of course, this is the pattern. No need to tell about this pattern. You all can see this thing. The change, the shift towards the telemedicine. The WhatsApp calls are very common. The digital channel, it is adopted, and many of the physicians are following even right now. Okay. So if we'll talk about the long-term delays, so yes, the clinical trials for the different areas, they are delays. Okay, the companies are they are trying to more focus it on the research and development. The countries are trying to self-sufficient for producing their medications to launch their products. Now they are self-independent. So this is they have done, and I hope with this I'm completing this slide. I hope you all got this about the pharmacoeconomics, the basics of it, and how the challenges are there, how it is associated with the COVID-19, and why we should know it. Yes. So thank you so much, sir.
Thank you so much, ma'am, for your this long and very brief and detailed discussion on pharmacoeconomics. And we are deeply thankful to you that you have given your time making this presentation, and you have touched almost all. And my dear student, this is a very innovative field, and in future is actually pharmacy. I have already highlighted slightly about the impact of COVID-19 in job. That is how IT professionals are actually losing. Only one field, if it is sustaining, this is nothing but else. It is only in pharma. And pharmacoeconomics is the future. So I hope, my dear participants, all of you got a huge inspiration from this lecture. So ma'am, with the permission, can we go for the question and answer session?
Yeah, sure, sir, sure.
We have received only one question. The question was, It was from Aditya Kumar. He actually from first year, or I think, he actually asked about the definition. I think he is trying to understand that if in examination if he have to write about the definition, then how he will define. So his question is very simple, that define pharmacoeconomics. So if you may give some light on this.
Okay, so yes, Aditya Kumar, this is a very simple term, pharmacoeconomics. This explains the cost and the consequences of the treatment. Okay, and it will go on the depth. So the cost could be of many types, and the consequences could be of clinical, the humanistic, and the economic.
All right. I hope Aditya you got your answer. And ma'am, this is a token of appreciation from our NIT Pharmacy Institute, and this is the certificate signed by our honorable director sir, and also the president of IIC, that is Professor Dr. Sundar ma'am. We will share the
Thank you,
certificate to you
sir.
at the end of this webinar. And now I'd like to request our convener, Honorable Dr. Rajesh Kumar sir, to deliver the vote of thanks. Over to you, sir. Good afternoon, sir. And I'm deeply thankful to you, sir, that despite your all the busyness in your this triathlon that we already have seen, sir, you have given your time. We are deeply thankful to you, sir. Good morning, sir. Sir, please unmute yourself. Your mic is. Sir, please unmute yourself.
Okay, now
Yes, sir.
I think I'm audible now. So thank you, Abhijit. Thank you so much for your kind words. And good morning, good afternoon, dear all, respected and dear. Today I feel honored and privileged to have been allowed to extend a vote of thanks on this occasion. So this is again a momentous day for all of us, as this is the first time that one of our youngest and energetic faculty members, Miss Deepika Pathak, which is also my student, took initiative. So he is the youngest and energetic faculty member of our institutes, and she took initiative and deliver a very informative lectures on pharmacoeconomics after the COVID era. So therefore, I want to extend my warm regards and heartiest thanks to Deepika ma'am. So she beautifully highlighted the perspective of pharmacoeconomics and patents after COVID era, from patents point of view, as well as service providers point of view, for example, different pharma companies and including insurance sectors also. She also highlighted various aspects of COVID cost minimization, cost analysis, then cost effective analysis, cost utility analysis, and other important information of the pharmacoeconomics after the COVID era. So that was a wonderful information, as it consists all the aspects of economy related to pharmacy sector after COVID era. Words would fall short of describing how much knowledge we have achieved from this lecture. So thank you, Deepika, once again for providing such a wonderful information. Then on the behalf of NIT Pharmacy Institute, I would also like to thank our respected director, Dr. Abhijit Majumdar sir, our respected Dean, Dr. Rupa Majumdar ma'am. Sir and ma'am, you always biggest motivation and support for all of us. Thank you for being always behind us. I would also like to thank our Honorable Managing Director, Dr. O.P. Agrawal, MD ma'am, respected Nima ma'am. Then we have respected Raman Batra sir as a executive vice president. So I thank all of them for providing all the resources for the smooth conduction of programs like this. They are always helpful as management. I would also like to propose a vote of thanks to all the faculty member and the students of our and other colleges who are part of that event. Last but not the least, even though everyone's role is very, very important, but with a special mention of Mr. Abhijit Devnas, as he always took initiative for such events as an ICC member. So he's just such an energetic person. Again, thank you, Abhijit, for conducting such a beautiful program. And I hope we continue to work like this and organize such a beautiful events for the future of our students and faculty members. So thank you. Thank you so much. Best regards. Over to you, Abhijit.
Thank you so much, sir.
Thank you.
Thank you, sir. Thank you, ma'am. And dear participants, I already have shared the feedback from link in our WhatsApp group, and the feedback from link is also available in the chat box of MS Team. So all of you are requested to fill this feedback form and share your experience your learning. And if you, after submission of your feedback form, we will generate your certificate. So thank you all of you for joining. I hope you got lots of information, and this information, this knowledge, and this understanding will help you in future in your career and learning. So thank you all of you. See you in our next webinar. All the best. God bless you all.